Welcome all. I'll be discussing on the entry and exit online assessment for glaucoma fellows that is being conducted here in EYExcel system. So I'll be covering on the course of the fellow entry in the program, the preparation done by the fellows, the structure of the online assessment, and some of the fellow outputs. So in India, the medical students entering the medical program undergo 5.5 years of undergraduate program, after which they undergo 3 years of specialized ophthalmological training. Followed by that, they enter their desired fellowship program, which is usually 1.5 to 2 years duration. So every year, 6 to 7 fellows join the glaucoma fellowship program here in Madurai at Aravind Eye Hospital. And as you can see from the past statistics, these fellows come from all over India with different levels of ophthalmological training. So when they enter the fellowship program, they have to undergo a mandatory comprehensive ophthalmological program of 3 months, followed by which they undergo a microsurgical training. This mainly focuses on small incision cataract surgery, and after this, they enter the first year of their fellowship program. In this, they acquire clinical examination skills, laser procedures, and carry on their surgical training. After this, at the end of first year, they undergo specified phacoemulsification training. Throughout their surgical training programs, they are assessed by OSCE rubrics of their surgical skills. So in the second year of their fellowship program, they carry out their combined phacotrabeculectomies and shunt surgery trainings. Throughout the fellowship program, we encourage the students to participate in journal clubs, fellow classes, and teaching programs held for postgraduates and ophthalmic assistants. While the students enter the comprehensive ophthalmology program, they are provided various resources for preparation for their entry exam. Some of the resources available in the Institute library are the resources on updates in ophthalmology and Dr. Wallace Alwood glaucoma videos. Dr. Wallace Alwood curriculum covers most of the basic glaucoma programs, and this is said to be very helpful for the trainees. Once they are ready with their preparation, they are provided a login ID and a password, and then they appear for the online examination. This is of 2 hours, consisting of 100 questions. They are all single choice questions, and each correct answer would be awarded 4 marks with negative marking for incorrect answers. This is an example of the entry level exam. They consist of clinical questions and image-based questions. Similarly, the exit exam is of the same structure with a different level of difficulty. Once the examination is completed, the percentage obtained by the students are provided to them online. However, the response sheet would be confidentially handed over to the head of the department for evaluation. I'd be sharing some of the fellow experiences. These are fellows of different levels of training. Some of them
I'm Dr. Kavya from Hyderabad. I'm doing my 1st month of fellowship in the glaucoma department. I have given my entrance exam after I finished my comprehensive ophthalmology. It was not so easy
as there were many tricky questions. I have referred books like Shields, Becker Schaffer, and I have also seen wireless videos which were there in the glaucoma department. During my 4 months of fellowship, I have seen many cases which were given as case scenarios in the exam, which actually made me think what I should look for while examining a patient.
This is Dr. Shivakrishna. I am in my 18th month of glaucoma fellowship. I gave the exam before entering into the glaucoma department. There were basic questions pertaining to medical management of glaucoma and visual fields, which are I felt little bit easier. Options related to the questions of retina and glaucoma are very tricky. Those questions are really helped me in my fellowship program. Actually, these are day-to-day clinical scenarios. And after the exam, I felt if we have some discussion regarding the questions, it will be helpful for us, as I cannot recollect all the questions. I was told about the exit exam. Seriously looking forward to have it. I felt some difficulty to balance the clinical OPD hours and study hours to give the exam. I'm eagerly looking forward to have the exam. Thank you.
Hello everyone, I'm Dr. Subhatra, glaucoma consultant from Aravind Eye Institute, Madurai, where I did my fellowship too. So during my fellowship, I gave an entry and an exit exam. Preparing for this exam, I explored many glaucoma books, studies and journals. And the exams also covered various fields like clinical scenarios, investigation, newer medications and the recent studies. So it helped me for self-assessing myself and made my fellowship program a complete success.
So we obtained different inputs from these fellows, and some of the fellows are asked to appear for the entrance exam twice to improve their understanding and performance. And the candidates who could not perform well in the assessment test and the interview are also asked to undergo a general comprehensive ophthalmology fellowship to improve their clinical skills, and then they are allowed to reappear for glaucoma fellowship program. So all in all, we found that the entrance examination helps to orient the fellows entering the glaucoma fellowship program, and they also provide a quantitative evaluation of the clinical acumen of the fellows both entering and completing the glaucoma fellowship program. Also, it motivates the fellows to read textbooks as well as recent updates in their field, even with strenuous schedule. Thank you so much.